Now pass the torch over to Portia and introduce her. Portia Gillespie is the Maternal Child Health Project Manager and Healthy Start. Well, before I continue with her introduction, I want to remind everyone we will be doing a Q&A after Portia's presentation for both presentations. So please feel free to continue to chat in your questions for both Tara and Portia. She's with Pittsburgh, where her work is supporting various initiatives geared towards improving the lives of Black women and babies by reducing health disparities. Portia earned her master's in public health from Slippery Rock University with a concentration in environmental health. She then went on to continue her work in environmental health, focusing on the environmental hazards that impact the Black community's ability to thrive within the places that they live and work. At Healthy Start, Portia supports the strategic initiative team by using her lived experience and professional expertise to support positive birth outcomes for both moms and babies. Portia, I'm so happy that you're here to present, and I'm going to turn it over to you now.
Awesome. Thank you. I'm really excited to be here and be able to talk to you all about this, the project. We are really excited to be able to receive the funding and kind of further the work that's been happening with Safer Childbirth Cities, as well as the work that's been going on with Healthy Start. And, you know, as the slide says, advocate for sustainability in the work that we're doing. Go to the next slide, please. All right. And just to, as I was already introduced, Candace, thank you for that introduction. My name is Portia Gillespie. I'm the Maternal and Child Health Project Manager for Healthy Start. And then my teammate, Demia, is on here as well. And I get the pleasure of working with her ongoing. But Demia Tyler, she is our Director of Strategic Initiatives at Healthy Start. And then I want to mention, she's not pictured here, and I'll explain a little bit more as we get further into the presentation, but we also worked with the Black Women's Policy Center, Rochelle Jackson, who's not pictured as I mentioned, but she was a big part of this project for us as well. Go to the next slide. You can click one more time. There's a graphic on there. Great. Thank you so much. All right. So Healthy Start, we are part of a larger initiative. We were chosen as one of 15 sites by HRSA in 1991. But we were specifically created based on that to service the Pittsburgh area. So we are a community-based nonprofit, and like I mentioned, we were created to further the initiatives of the overall Healthy Start project. But our overall goal is ultimately to improve maternal and child health and reduce the poor birth outcomes that we see as such a large issue in Pittsburgh and many different places. But as far as the Healthy Start model, but again, we're focused specifically in Pittsburgh. But our services span both Allegheny and Westmoreland County. We have offices in both. You'll see on the next box, I know it's kind of small, but it says the community health worker model is a big part of our Healthy Start services. We have many different projects and services, but one of them includes our direct service, which we are ultimately trying to meet moms and birthing people where they're at and service them directly. And we do that through many ways, but one being the community health worker model. And we also have various initiatives within policy and advocacy. Our community health worker model supports our direct service work by providing one-on-one visits to recent moms and birthing people and supporting them across the perinatal spectrum. This specific program, the community health worker program, follows baby up until 18 months, and it's just an additional way that we at Healthy Start are trying to support moms and not only having healthy birth experiences, but also making sure that babies remain healthy in the first year of life. We know that studies and data has shown that first year of life is especially crucial for mom and baby. It's not just when babies are born. That first year is very important. So we really try to tackle any of those issues and just be an additional support to them as well. And then I just want to highlight one additional aspect of our advocacy specific work is our recruitment and training of community members to be community health advocates for their communities. And that's something that I'll explain a little further on in the presentation. to the next slide. All right, and then this graphic I really like. It just really kind of sums up the things that I was saying, but also just specifically tells you about the different programs that we have. So I'll touch a little bit on those. We have our Center for Urban Breastfeeding, or our CUB, that you'll see. That is just a way, again, all of our things geared towards improving birth outcomes and protecting or supporting moms and babies. But the CUB is specifically for breastfeeding. It's for our Black moms, and our services there are just to support them if they want to breastfeed, if they're on that journey. We have our Latch line, which is just another resource they can call in and get that breastfeeding support. That consists of certified lactation consultants that will help moms along that journey as well. We have our Healthy Start home visiting program, which is what the community health workers fall under. So as I mentioned, the Healthy Start home visiting program, you have a community health worker assigned to you. They start with you, they're assigned with you. They do different mental health screenings, making sure that you're okay, providing any supports needed up until birth. And then afterwards, they stay with you for 18 months. Our doula support, we have our postpartum and birth doulas as well. We have our Moving Beyond Depression, which is our mental health services. We do screenings for moms, making sure that, during the pregnancy as well as afterwards, that they're doing okay. Our Hello Baby Priority, our parent cafes, and then our community health advocates are just some additional programs that we offer as well. And our community health advocates, I'll touch a little bit on that. Our community health advocates, as I referenced in the previous slide, are our moms that we train and recruit. They go through an 8-week session or an 8-week course, learning different public health skills, topics. We support their knowledge of different various public health issues. And then we build on their lived expertise that they have already in their communities, and basically training them to become advocates for their own communities. We understand that their expertise is the most valuable and that they're the best people to speak on what their experiences are. So we really try to build on that. And then afterwards, they graduate, they have that extra professional development, and then we continue to engage them in our Healthy Start initiatives ongoing. We compensate them for their time, and all of our community health advocates stay on with us in some capacity, working on various projects. That leading into our Safer Childbirth Cities, we were able to engage some of our community health advocates in that way in our Safer Childbirth Cities. So we can go to the next slide and I'll continue a little bit more on that. So in our Safer Childbirth Cities, Healthy Start has been fortunate to be both a partner and serve as the advisory board for Safer Childbirth Cities. Part of that included our Community Advisory Committee, or our CAC. Since the beginning of our partnership, that's been a big part of our role within Safer Childbirth Cities. We have made tangible progress in our goals of recruiting mothers and birthing people, again, building on their lived experiences, and they are serving as those community voices in that Community Advisory Committee. They meet regularly. It's a way that we keep them engaged, and they are the ones pushing that work forward as far as the Safer Childbirth Cities goals. And through these initiatives, ultimately, Healthy Start has worked to empower mothers to create change within their own communities. Again, it's really important to us at Healthy Start that we know that they're the experts of their experience, and we really want to elevate that rather than telling communities and telling these community members what they need. We want them to be on the forefront of that work. Next slide, please. And then there's just a couple pictures of a couple of our community health advocates. As I mentioned, after they go through this 8-week training, we really try to plug them into projects that they want to be a part of, but we also provide ongoing professional development opportunities. We really try to get them plugged into different conferences in Black maternal health and really try to keep them at the forefront of this work for Healthy Start. All right, and we can go to the next slide, please. All right, so challenges to sustainability for our project. We have a lot of, like I mentioned, our active and communicative partnerships. We have a lot of partnerships with both the community and other external partners, but that's something that, we really want to see continuing. I think when it comes to the definition of sustainability, the challenges, it kind of invokes the the definition of how we see sustainability in these different challenges that we see. Ultimately, our goal is to improve these birth outcomes, but we see that, you know, lack of stable funding streams and financial resources is something that's needed for this work to be sustainable and for the outcome to be what we want it to be. And so sometimes, you know, that's obviously something that we see as a challenge. Making sure that the work we're doing in advocacy is beneficial to the community. As I mentioned, you know, we always want to make sure we're advocating for the community, but we want to elevate the voices of the community and make sure that the work that we are doing is something that they see as beneficial for them. Continuous monitoring of success. We do a lot of, you know, needs assessments, trying to make sure the community is still bought into the work that we're doing and that they still see that our work is beneficial, and then continuing to engage community and honoring the community expertise. It's very easy for us to, again, tell people what they need and come in and, you know, use our experiences, but the community experience is the most important. So we really try to elevate that. And that's a challenge, figuring out the best outlets and best ways to keep them engaged in this process. Next slide, please. Okay. And then our sustainability grant project. So again, we were really excited to be able to receive this funding. We were already doing our community health advocate work, which I don't believe I mentioned before. We have thus far had 9 cohorts. We are actually graduating our most recent cohort this week of 9 women that are part of this cohort, but we have overall over 80 community health advocates that are engaged in some capacity with Healthy Start. So we were really excited to be able to take the community advisory committee members that it gets kind of confusing, but our larger overall community health advocate group, we, as I mentioned before, took some of those moms and engage them as community advisory committee members for Safer Childbirth Cities. And then we pushed that out to that group, asking them if they wanted to be a part of the sustainability grant project, recognizing that, you know, all the work that we're doing on the ground, all the work that they're doing in their communities needs to be elevated to policymakers for real change to happen sustainably. So through this project, 6 of our CAC, which stands for our Community Advisory Committee members, completed 4-session virtual trainings in advocacy led by the Black Women's Policy Center. So usually the Black Women's Policy Center, this is something that they do ongoing. So it was a really great partnership to be able to bring these women to the Black Women's Policy Center where they can support the advocacy efforts. The Black Women's Policy Center was able to not only train them in how to properly advocate, and be able to meet directly with legislators, but also to develop a policy ask that they thought was meaningful. The training was based off of an already existing model. Like I mentioned, Black Women's Policy Center already started this model, and we kind of just supported them with this grant, this funding, and brought the people to them. But it was adapted to best fit the needs of the project and the cohort, these women individually. There was a lot of one-on-one meetings that we had with the Black Women's Policy Center and these women that were involved, making sure that the model, we didn't want to make any extra barriers for these women. So making sure that the model that was already existing worked for them. And then, as I mentioned, the participants were trained in both policy and advocacy, and they were guided by the facilitator, Rochelle Jackson, and how to both develop and deliver a meaningful policy ask. All right. And so now the training is complete. That was the major part of the grant project. We wanted to be able to not only, we really believe that, like I mentioned, the voices of the community is expertise. And so we want to make sure that they're compensated for their time as they should be. So we used our funding to be able to support that and be able to take them to attend. We're hosting an advocacy day for this group of women who were trained, and we will be able to take them to Harrisburg, and at the end of October it's coming up, and they will attend a legislative session and be able to deliver that policy ask that they developed directly to legislators. They chose to focus specifically on paid leave, family leave. We know that all of those things are very important to the outcomes of moms and babies. So that was something that they chose to specifically focus on. And then through this opportunity, we were not only able to provide stipends to support their efforts and time by compensating them for these, it was 4 weeks of training. It was Saturday mornings. It was 4 hours on Saturday, you know, that's a big chunk of time that they were giving to us. And, you know, some people taking off of work or spending less time with their families. And again, their expertise is valuable, extremely valuable. So we wanted to make sure they were compensated, and this funding was able to support that. And we are also able to pay for their travel and their lodging needs, their hotel expenses, food expenses to get them to Harrisburg. We also provided childcare stipends because we want that to be something that's accessible and equitable for them, knowing all of these women are moms. All right. And then measuring success for this, it's a very, I think it's a kind of a unique project because it's kind of building on some work that's already being done, but also, you know, taking it one step further and being able to continue this work, because ultimately, like I mentioned, we know that we're doing a lot of work on the ground in our direct programs, but we want to make sure that at the end of the day, what we need to see is policy change. There are gaps in policy and things that need to be corrected and improved. So at the end of the day, that is the success that we're ultimately tracking, is seeing those policy efforts, seeing that legislators are adopting the policy asks that these women are bringing to them, and that they're hearing the community voices. Ultimately, that's what we wanted. We wanted to get these community members directly in front of legislators so that their voices are heard. And so that in itself is a big success. They need to hear the experiences of real people and what's going on. And then capturing the reach via community engagement, seeing how many women were involved in this grant project. We would like to ultimately open up the training that was given to these women to our larger group of CHAs and do this again and replicate it. We ultimately want them all to be, you know, have support their knowledge and advocacy. And so that's another measure of success for us. And then ultimately, like I mentioned, tracking the movement of legislation through government, seeing that what we're advocating for is actually coming to fruition in government and in real legislation. So then what we hope will be different after the sustainability project. Ultimately, we want community members to understand how they can be involved in policy and legislative efforts. I think one major thing that we see in general is, and I think just in the world that we live in right now, you know, especially when it comes time to vote for legislators and policymakers, you hear a lot of times people don't really necessarily see that their vote counts, or, you know, the things that they're advocating for, especially in grassroots like organizations. You see a lot of time that people don't necessarily see what they're advocating for come to be a reality. So we want community members to understand that they can be involved in legislative efforts, and we want to be able to support that. We want community members to feel empowered to engage in policy discussion and processes, and that was the reason behind the advocacy training. We didn't want them to feel like we were just saying like, okay, this is great work that you're doing, and we just throw them in. We wanted them to feel that they had the training and the skills and knowledge to be able to do it successfully and make a real impact, and that they felt confident in that as well. And then community members feeling comfortable educating individuals within their own social network. We feel that ultimately after this advocacy day and this legislative session that they attend, this is only kind of getting their feet wet. They can kind of go back into their communities and be able to, one, help other people, bring other people along with them, and be able to pass that knowledge on and continue the work even after this project is finished. All right. And then in conclusion, some external factors that were involved in sustainability, like I mentioned, availability of funding for sustainable funding streams to be able to do this work ongoing. Those were factors. Burnout, I know in the previous presentation was mentioned a little bit. I think when or mentioned in the previous presentation, we see burnout a lot, especially in our community health advocates. I think, you know, since we're on our 9th cohort, we have some moms that went through the cohort years and years ago, and now, you know, things are changed. Life can get hard for everyone. They're moms, you know, they're dealing with all the different things in life that, you know, can just lead to burnout. And so sometimes that can be a factor with kind of replicating and continuing this project on, making sure that we kind of alleviate those factors so that we can keep people engaged. And then the nuances of policy change. And then what would accelerate our access funding? I think I keep saying, the different having reliable sources of funding to continue this work, and then more community health advocates, or CHAs, as you see. We're always looking. Every year we do the same training, and we're always looking for new moms. We know, again, that that their expertise cannot be replaced. So that is something that, we continue to see our projects move forward successfully, and the real benefit coming from having those community members be engaged and being the ones to not only advocate for their communities, but also be the voice for their community within the community, bringing people along with them. And then this is just a picture of some of our community health advocates. Like I mentioned, we have a lot of different events where we try to engage our community members. A lot of different things celebrating them that we do. Like I mentioned, we have a graduation for them after they finish after they finish the program. I think the community health advocate training is like one of the best things that we do. So this is just a picture of some of them and our Healthy Start, a couple of our Healthy Start staff. Our CEO, Demia, is on. Our CEO is on here. Jada, Demia is on here, and we really love those opportunities to be able to engage with them in fun ways and be able to support them ongoing. So I just want to kind of close us out by just amplifying the fact that the community health advocate cohort and the community advisory committee is something that we see as very extremely valuable, and we will continue to engage community in that way, because we feel that our programs are nothing without them. And that is the end.
Thank you, Portia. It was so wonderful hearing about all the wonderful things that your program's doing as well. I'm going to not talk long because I want to address any questions that our attendees may have. So I'm going to allow the panelists to be available.